Amid the COVID-19 pandemic, work at the State House goes on. I spoke with Massachusetts State Representative Angelo Puppolo of the 12th Hampden District about the state budget process and ongoing legislative efforts to mitigate the economic fallout from school and business closures due to the outbreak of the novel coronavirus.
We're definitely right in the middle of the peak, sort of the surge, if you will, and yesterday we had over the first day of announced over 100 deaths in one particular day. So far we're over 1,000 in the Commonwealth of Massachusetts alone. So the factors are certainly mitigating in terms of some of the areas with the social distancing and the plans that the governor and we've all put in place. But we still got hot spots. I mean, right now Chelsea and other areas in the Commonwealth, some in the eastern parts, some in the central Mass are really become hot spots in terms of a large number of outbreaks. But that's typical. I think we're going to continue to see that based upon what the CDC says and, some of the other public health officials in terms of, what happens during, the surge and whatnot. So I think it's, I don't want to say as going as expected, but it is sort of, following a course that we've kind of thought, but we're keeping an eye on certain places.
Now, I know that the state has just started to release town-by-town numbers. Some people were a little bit concerned about that, wondering if it would sort of out families. How do you feel about those numbers actually out there for people?
Well, I mean, I know originally the administration was hesitant to do that because they did not want to put a sort of stigmas on a certain community. But I think it's helpful to see where, the numbers are, where this, sort of population is. And I think it's an important number to see. So, I mean, and I understand the stigma and all of that in terms of saying, well, it may be, looked upon in a bad sense, but I think people need to have that information. Maybe there's an area where, you don't go into if you don't necessarily have to. The people there are more cautious. So I think it's helpful. I'm glad we're doing that finally, and I think it'll be a benefit to both the community as well as people outside the community. So I like that idea. I know
you've been sending out updates to your constituents. A big focus of your most recent one is long-term care facilities. We had talked a little bit about the numbers of people who have died in Massachusetts, over 1,000 now. Nearly half of those are residents from long-term care facilities. What's being done to sort of help those facilities manage this?
Well, right now, we're certainly, it's been on our radar screen, but right now we've really stepped that up. Those facilities have been really hot spots. We've basically got, in Massachusetts, there's over 38,000, people that are in nursing homes and over 16,000 that are in assisted care living throughout the Commonwealth. So, currently, there's some areas that are, in those facilities have been really increased numbers of positives and testing, and we've really stepped up the watching and the reporting, which is critically important. We've passed an additional $130 million funding for nursing homes and assisted living centers. That's key money. I mean, a lot of that is going to go towards additional staffing, which is what we've been hearing. These facilities need staffing, much more staffing, especially when some of the nurses and other care providers contract the COVID-19, and they've got to be out of commission. So staffing has been a big issue, and even when you have a facility that has positive patients, you need more staffing that are healthy just to take care of the certain people. We're trying to make sure that they get isolated, and that is, again, more care, for isolation units in terms of having dedicated staff in that particular area of nursing to, sort of stop the spread as much as we can. And then some of that money is going to go towards, the PPE, the protective care equipment, which is, critically important. That's what we're hearing. And the mandated reportings, we've actually got another conference call on that this afternoon, and we're going to be discussing that. And we want to make sure that we stay on top of it. Unfortunately, some of the facilities, such as the Soldiers' Home, for whatever reason, in Holyoke, that sort of spiraled out of control. We want to make sure that does not happen anywhere else.
And when you talk about a nursing care facility, one of the issues that you had brought up in that email blast to people is a response clinical team and crisis management. How do you sort of support those facilities to either isolate patients or move them out to another area?
Well, that's what we're trying to, come up with. Some areas it's a little bit easier to do. We're moving them off-site to other locations, if it's possible, or suggesting that. I mean, again, at our facilities, the Soldiers Home in Holyoke, for example, as well as the one in Chelsea. I mean, in some of the other facilities that, we may manage, it's a little bit easier to do, but we're having guidelines in these facilities that isolation certainly is key. In some of the areas, the facilities have that ability to do that. If they're extra space, if you will, they're utilizing space in different areas that aren't, going to be utilized now, cafeterias and other places, just to keep people isolated in terms of that. And then if they can't, we're looking at, nearby facilities. Now, some people are not in the condition to be able to move. Some family members do not want, them to be moved. So we're dealing with that as well. But, I mean, we're trying to either figure out what can be done inside the building to keep it isolated, or if we have to go, off-site to, what is a reasonable, pragmatic approach. Again, isolation being the key thing, and considering the condition and the health of the person and the ability to move. So it's challenging. I mean, there's no doubt about it. And I mean, these are the things that, we're dealing with, and we're trying to, come up with reasonable plans in terms of, being efficient, but also, a lot of this stuff has to be done quickly, so when something happens, so we don't have a big outbreak, we got to contain it. And that's the big thing. We want to make sure that these care facilities understand that. We're here for assistance. The Secretary Sutters and everybody on the team is working as hard as we can to mitigate any problems.
Talk a little bit about the financial hit that the hospitals are taking as well, and some of the support for them. Obviously, elective surgeries are canceled, so many hospitals, most of them, are all in the same position.
Yeah, I mean, we've been on conference calls locally, with hospitals in our area. I've also been on conference calls, with House leadership and others, and the hospitals across the state, whether it's in Boston or Worcester or Springfield, Pittsfield, they're all, feeling a big pinch. Yeah, elective surgeries are pretty much, at a halt, and rightfully so, given everything going on. But it's very problematic, and so the funding there, the money coming in there is really, really short. And, we're seeing that catapult, not only in that industry, but really across, government completely. So, I mean, we're doing what we can, in terms of assisting them. They're doing what they can. They're prioritizing. I mean, Bay State's doing a tremendous job. Trinity here, Holyoke has stepped up to the plate, Holyoke Hospital. And, a lot of things going on. But I think the silver lining out of all of this is you see all of these, businesses that are coming through and helping our first responders. And, whether it's Nathan Bills providing, thousands of meals over to Bay State and Trinity. Nadine's stepping up to the plate. There's the Fill the Bus campaign with the Peter Picknell and Andy Yee and those guys. So, I mean, there's a tremendous amount of support that are going towards the first responders. And that's just in our area. I mean, this is happening in Boston and all across the Commonwealth, all across the country. It's really heartwarming to see. It doesn't affect the hospital's bottom line, but certainly helps, the employees, and makes you feel that, people are more than just appreciated.
And businesses are doing this as they're taking a huge financial hit as well. Can you talk a little bit about, unemployment and supporting people as we're kind of in this sort of holding pattern? So many people are out of work.
Well, unemployment is huge. I mean, my district alone, normally thankfully, I don't have that many unemployment issues. Some other, areas are much more prone to that. But I will tell you, in the last recent weeks, my response has gone up tremendously to help people. And, just this last week, we had over 103,000 new filees for unemployment claims. And so far during this pandemic, we're over 572,000. I repeat that, 572,000 claims just in the Commonwealth of Massachusetts for new unemployment claims. So a lot of times, there's been mistakes in terms of what some of the, applicants enter on the online application. So that kind of holds things up. But we've been processing, we've been helping. I mean, we've been getting, believe it or not, 5-6 calls in my office a day just on that alone. And we've been able to facilitate and help somebody like that. And I know my colleagues across the state are doing the same thing. So it's a big hit for the people personally, but, it's certainly a big hit for the economy. I mean, I know some of the reports came out. We've been talking on the legislative side about, revenues. Normally, yesterday would have been the day the budget came out. We would have had our House budget, revealed. We'd be right now furiously sort of filing amendments. Normally there'd be over 1,000 amendments filed in the 2.5 sort of day period, and we'd be debating that in the following week. We'd be having a debate in a week and a half about our budget, and that's on hold because we don't have revenue. We've adjusted the consensus revenue figure that we think we're going to be coming in, and we haven't even begun to sort of figure out and sort of tackle how this is going to affect it. I mean, report that came out just yesterday about gaming revenue tremendously down, about pretty much over 50% at all the casinos. They're obviously had to close the middle of the month, so they only had about 2 weeks of March. So their revenues are down, which cascades into our revenues, right? So we're not getting the tax income. Recreational marijuana, like it or not, was here. We were counting on some of that revenue. Now, they haven't been able to open. That revenue is drained. So we're in a precarious situation. So from both an employee standpoint as well as a Commonwealth standpoint, and then obviously employers. I mean, you see all kinds of problems. And as you mentioned, these restaurants and these other businesses that are helping out in the community are basically taking big hits themselves. So their generosity is huge, given the fact that they're again not doing what they normally would do by any yardstick measurement.